the high table, and then Professor Lydia Asiato also to join Madam Chairperson. Thank you very much. Next, Public Health University of Ghana. He's in the person of Professor Jude Program.
Thank you, Mr. Moderator, and good morning to everyone. Madam Chair, Madam Dean of School of Nursing, HODs and colleagues from SPH, representatives from schools department at University of Ghana, representatives from World Health Organization, representative from Ghana Health Service, reps from the Health Education Program SHEP, social innovators and implementers in health, invited guests, friends of the media who we always have to look over our shoulders when they are here, ladies and gentlemen, it's an honor to welcome you all to this important National Dissemination Workshop on Social Innovation in Health Initiative in Ghana. I wanted to thank you for accepting our invitation to come here. As you may be aware, the Social Innovation in Health Initiative is a global network of passionate individuals, organizations, institutions advocating for social innovation in health and advancing research in social innovation to increase universal coverage and progress towards achieving sustainable development. As a member of this global network, SIHI-Ghana's initiative is to create a critical mass of SIHI advocates, researchers, and practitioners to improve healthcare delivery in the country and beyond. Of course, as you may be aware, this fits well within the schools of public health vision to promote knowledge, not only to promote knowledge, and to be a lead advocate for needed public health reforms in the country. The school, therefore, has been supportive of the project, and of course will continue to give the necessary support as may be needed in the future. It is my hope that our students, both graduate, undergraduate and graduate, will take advantage in this to develop interest to be lead researchers and advocates of social innovation in health initiative to improve healthcare delivery, not only in Ghana, and of course, across the West Africa sub-region. As you know, the school prides itself as a leader in public health education, not only public health education, but provide leadership in research training. The school is therefore hosting a number of such huge initiatives in capacity building in the region. And of course, SIHI is one of these capacity building efforts. Madam Chair, Dean of School of Nursing, invited guests, of course, our media partners, ladies and gentlemen, it is my belief that this project will further push the vision and mission of the School of Public Health into the community to enhance its image at the School of Public Health without walls. This concept has been with the school since its inception. And just to give you a brief overview of the concept of school without walls. When the school started, it had no infrastructure. It had no offices for its staff. So to sustain the school, it was, of course, that was when innovation started. So we're hiding in every corner of this university. So it was quick to say that a school without wall, which means that we'll not only sit in the university domain, but take our efforts into the communities. So the first batch of trainees would spend some time in classroom because we had really limited classrooms. And then, of course, they move into the community where they will participate in problem solving within the regions. So a school without wall means that we are not only sitting in the university, the ivory tower, but we are very much present in the communities. Madam Chair, not to just keep you waiting, with these few words, I wish to extend a warm invitation to all present to join in SIHI-Ghana effort and contributing to healthcare delivery in Ghana and other West Africa sub-regions. So I want to warmly welcome all of you to this program and to wish you deep engagement and fruitful engagement. Thank you very much.
Thank you very much, Dean, School of Public Health, Professor Julius Phobel. Please, ladies and gentlemen, another round of applause for Professor Julius Phobel. Next on the program, we would have a few remarks by the Dean for School of Nursing in the person of Professor Lydia Aziato. Please, let's welcome Professor Lydia Aziato as she gives a few remarks.
Thank you very much. Good morning to all of us, and thank you for inviting me. Standing on existing protocol, I wish to extend a word of congratulations to the school and the project lead and all the members of the project team. I'm particularly excited about innovations in access to screening for cervical cancer. Research data indicates high numbers of late reporting of cancers to the hospitals. And being a nurse, I'm happy that this project is taking a look at cervical cancer screening so that our women will be saved when signs are detected early to enhance success in treatments. I'm also very excited about the program or the projects on women in TB. So once again, because I'm a little biased towards women's health, anything about women excites me. So TB, HIV co-infection is also a marriage that can lead to early death or high morbidity for our women. So I'm also very happy that this program also has an umbrella or a segment that takes into consideration TB, HIV co-infection. I'm extending this, shall I say, opportunity to all researchers to find space in their busy schedules to disseminate the wonderful work they are doing in the various schools and institutes of the college so that all will benefit from work that has been done. And on this note, I want to thank all of you for a wonderful program. And I pray that we all learn from our esteemed researchers. Thank you very much.
Thank you very much, Professor Lydia Aziato, Dean for School of Nursing and Midwifery. So next on the program, we are going to have a word from a very distinguished personality. She would be joining us online. So the crew would put her through when we are ready. She's in the person of Professor Hannah Akufu. And currently, she's retiring as a CEDA advisor. She doesn't want us to say much about her, but a few that I can say about her is that she's a retiring CEDA advisor. She's a TDR Global member, and she's also an advocate for SIHI. So please, ladies and gentlemen, if Professor Hannah Akufu is ready, let's welcome her with a round of applause, please. Okay, so I understand we have a few technical challenges, so we can move on to the next on the program. Also a word from another distinguished person, also joining us online via Zoom, is Dr. Joe Tucker. Dr. Joe Tucker is a member of the Social Entrepreneurship to Spare Health, and is also the co-founder and advisory committee chair for Social Entrepreneurship to Spare Health. He is also an associate professor with the University of North Carolina School of Medicine, and also an associate professor with the London School of Hygiene and Tropical Medicine, and currently chairs the Social Entrepreneurship Spare Health Steering Committee. So, ladies and gentlemen, with a round of applause, let's also welcome Dr. Joe Tucker online to give us a word.
Thank you. Can you hear me okay?
Yes.
Thank you. Thank you so much. It's a great pleasure to be with you all here today. I'd like to extend my congratulations to the whole SIHI-Ghana team, and it's really wonderful to see this sort of strong commitment from leadership, and to see this distinguished cast of folks. Thanks and to Dean Stovall and Dr. Asiago and Chairman Dr. Okieke. I want to say a couple of brief words about social innovation. I think COVID in particular has shown us all how social innovation is so important, that we can't just think about biomedical fixes, we can't just think about experts, we need to think about ground-up, community-engaged approaches, and social innovation has really been rising up, and I think it's been a very exciting time for social innovation in health. And the other part of this that's important is Ghana and the hub in Ghana. I have been so impressed with the team in Ghana and the energy, the momentum, the rigor of research. I think it's really a fantastic team, and I expect great things from the SIHI-Ghana team. I really think this is the ecosystem that has been built is remarkable. And you only have to look at the titles of the talks that are coming after this to see that there is really important research and social innovation projects that are happening here in Ghana. So